Hello, my name is Jacinta Flynn. I'm a third year Bachelor of Nursing student at Swinburne University, Wantirna campus. I'm currently applying for the 2021 Mental Health Graduate Nurse Program at Bendigo Health. Why I've chosen Bendigo is for my very first rural placement in my diploma course. I fell in love with regional hospitals and communities. I've been lucky enough to do several rural placements since then, as well as Melbourne placements. It just cemented to me that that's where I want to be. Bendigo also offers 3 clinical rotations, which I think cover different age groups and inpatient and community settings, which will give an overall view and rounded idea of how mental health sits within the community. I'm also invested in continuing to study, believe it or not, at my age, and going on to do my advanced diploma and hopefully my master's is something that I'm really looking forward to, and I know Bendigo Health offer that and will offer support to get to that point. When I finished my diploma of nursing, I was determined to get a job as an enrolled nurse in the mental health sector. I was lucky to secure a casual position at Peninsula Health in their adult inpatient mental health unit, 2 West. I had been told that it was very similar to the forensic care environment, and that's where I did my mental health placement. And I'm really so glad someone gave me that piece of advice, because when I turned up to my first shift and said I was new, I think they probably all thought, oh, she's just new to Peninsula Health because of my age, but I was actually new to nursing, full stop. But when I walked out into the floor that day after handover, I felt at home. I thought, this is exactly where I need to be. It's exactly where I want to be. It was very intimidating and I was very nervous. But by the end of the shift, I just knew this is for me. My experience as a student nurse has also given me some amazing opportunities. And I've realised that in every placement that I've had, acute or subacute, there's been mental health conditions. This was especially so in some of the rural hospitals where they didn't have the facilities for mental health patients. On my very first placement, there was a young lady who had just lost 2 friends to suicide, and luckily she had a really good rapport with her GP, who had said to her, I want you to present to ED, I'm going to call them, I want you to go and turn off your phone, have some rest, eat and be cared for. So this young lady came in and the nursing staff were fantastic, but at the end of the day she was in an acute ward and she really had some mental health issues. But I was a student and they said go for it, talk to her, spend time with her, which I did, and it was amazing, and I really understood why that part of nursing was where I needed to be. The communication, the less task-orientated day, although I know it is task-orientated and we have to do things and there's a time frame, but you do have more time to spend with the patient, and I loved it. On my second placement in another regional hospital, there was a lady who had several mental health conditions, but she was also withdrawing from alcohol and drugs. And again, while the staff were brilliant, she really should have been in a different facility where those needs could be catered for. And again, I was encouraged to sit with her and talk to her and be her nurse. And again, I just love the experience of being able to spend time with someone and talk to them about their life and where they're heading and how they can be helped. And then in a big Melbourne hospital on an orthopaedic ward, I dealt with a lady who had severe anxiety, and I thought maybe that was just to do with her operation, but her mum pulled me aside and said, you know, she suffers severe anxiety in life. She won't get help. She doesn't really know where to get help. She doesn't want to take medication. And I realised this had just overcome this lady's life. She really did need help. And again, she was there for an orthopaedic operation, so that was the goal, to fix her, but really her mental state was what needed more fixing. What can I bring to Bendigo Health? I have 20 years experience of family members who have suffered mental illnesses, This has given me a huge insight, understanding, and a reality check that, you know, it can happen to anyone, and just how difficult it is to navigate the healthcare setting when you have mental illness. It's also what I've got from being a mental health nurse now for a short period is I can understand from those people's point of view. So when the patient comes in, I know that their family and their carers need to be part of that recovery orientated program. I know it's not just about the patient, it's about everyone. This affects everybody in their life, and as a nurse we need to work with them as well as with the allied health team and the doctors, and it is a team effort. And having had experience now on both sides of the fence, I really understand where everyone sits and how it is such a big team effort. I would also just love the opportunity to work in a big regional hospital, and I think that because I have been lucky enough to secure placements in regional hospitals, that's also given me experience of how they work as a community and as a team. I do have some questions for Bendigo Health. I'm very interested to know what after graduation, do most of your graduate nurses retain employment with you? And do the inpatient staff and teams work closely with community? The community team, I've had a couple of occasions where I have worked in our step down unit for the community care centre. I didn't think I was ready to do that, but I took the plunge and took a couple of shifts, and what I loved about it was I was stepping into dealing with patients I dealt with on the inpatient ward, and to see the smile on their face when they saw me and vice versa, and to see that it was actually, recovery was happening for them, and that the steps we'd put in place, you know, were working. And although, you know, often they would come back to the inpatient ward, I knew where they were going after that, and what a great position that was to be in, to be able to know both things. So I'm really interested to know, as a nurse with Bendigo Health, is do you all work together? Does that happen? Unique experiences, I guess, from my point of view, is age. Life experience. I've worked in many different industries with many different people in a couple of different countries. I'm a mum of grown-up children, and dealing with people in my family that have been through that. So I feel, coupled with everything, it's given me the patience and the understanding to really go forward and secure this journey and career for what I'm so passionate about, which is mental health nursing. So thank you so much for listening to my video, and I hope that I have the opportunity to meet you again in an interview situation and not be so nervous. Thanks again.